in 8 hours. Because I can't get any more exposure than 13 minutes. If not, I'm gonna, over time, get the radiation. So just trying to keep that in mind here for us. And you'll kind of keep flipping through this and say, oh, this sounds familiar to me. I saw some questions that this helped me with. So this here, I'm gonna flip through these. So here is, RNs need to do something now. Position oxygen IV. So what I hope you say is position. What are the positions that we put patients in? So if the patient is short of breath, what position do I put people in? Yeah, so I would do semi-Fowlers, then I would do Fowlers, and then I would do high Fowlers. Because I know sometimes if they're a little short of breath, I sit them up, then I sit them up more, then I do high Fowlers. But I remember that high Fowlers is for GI also. So I just gotta remember that if you're really bad, I get you way up. But high Fowlers is also my GI. You would do that, remember, GI. Food forward, flex, chin to chest. So when patients want to eat, high Fowlers, chin to chest, so they don't aspirate. And so if they asked you about putting in an NG tube, and you said to yourself, I've never put an NG tube in, why are they asking me? And maybe I never saw one in clinical. What would you say in terms of your ability to critically think? Since I've been noticing, I don't know, most of you look sort of well-nourished, so I think you've all been eating at some point in your life, right? And you've been feeding patients. So if you feed patients, and your patients don't aspirate, and you want to put an NG tube in, what would you say? Food forward, chin to chest, flex. I'm not going to hyperextend, because hyperextend is opening my airway, and that is how I suction patients. But if they want to eat, or they want me to put the NG tube in, food forward, flex, chin to chest. So you're going to pay attention to position answers, because they're going to be very, very important. So if I'm weak and dizzy, and I feel like I'm going to pass out, how do we position people? Flat, flat. So someone said flat. Someone else probably said supine, which is spine without the U, I'm on my back. Or somebody who's really fancy said modified Trendelenburg, right? Head and chest are flat, legs are up in the ear, so modified Trendelenburg, legs up to increase venous return. So those are very important. We'll do one more, and then we'll get to some other positions later. So who do we put prone? Not too many people we put prone. There are 3 major people we put prone. Odds, not a bad answer, but there's lots of things we do with them. So there are 3 major patients who get prone always. The ARDS patient at times gets that way, but there's one respiratory person. And I think you know this from 2000. How about spina bifida babies? Yeah. Okay, oh, spina. Oh, spina has a P in it, doesn't it? Spina bifida, prone. Who else gets that? Something we don't do a lot, chest PT. Chest PT goes prone. And those amputations after 24 hours. So those are the 3 major people that go prone. Spina bifida, chest PT, amputations after 24 hours. And on this test, you are to assume you have an order or anticipate an order for. So if you think the patient needs oxygen because their blood gas or their pulse ox is low, you're going to say, I'm going to give the patient oxygen. If you think the patient needs IV fluids, you're going to give it to them. If you think they don't need the IV fluids, you're going to stop them. One of the things they do on the test that we don't do a lot in this part of the country is if the patient doesn't need a lot of IV fluids, they'll say, decrease the IV to keep vein open. Keep vein open, which means the patient gets about 20 to 40 mils of fluid an hour. We, in clinical here, see a lot of saline locks, but people don't do saline locks throughout the country. So keep vein open, 20 mils an hour. That's like only 500 mils in 24 hours. Do people have this one? Is this missing on it?
Yeah.
Yeah, so I'll have Karen send this one out to people, or I'll send it out to people. It has more in it, yeah.
I thought the IV pump only could go up to 50 or something. Is that true?
Oh, no, depending, IV pumps can go down to even like a point. You could do 0.5 on the IV pump. Some places just have ones where you have to do 1 mil, but there are pumps that can go lower. So you can do it down to 10, 20, 30 mils per hour. Yeah. Good question. So let me just do one quick thing I say to people, that I had met this person once who she didn't pass her boards a couple times, and I always said to her, oh, she seems pretty good. I thought, oh, what's her problem? And so she was very, very nice. And so I said, what do you do? And when people are, because if you can't answer these two questions, like what do you do when people are weak and dizzy and feel like they're gonna pass out? If you can't say lie them flat. Sometimes when I ask people that, they say, oh, I sit them up. And I'm like, I think before nursing school, that if someone said they felt they were dizzy, you probably had them lie down. You didn't have them get up and walk. And so I said, what do you do when someone gets weak and dizzy at your job? And she taught gymnasts. This is gymnasts. And like I said, I'm kind of a little judgmental. I said, really? What do you because on the test you said you sat people up who were weak and dizzy and vomiting. Oh yeah, sit them up, sit them up. I'm like, well, that's probably why you didn't pass. But so I said, so what do you do? Because I said, so I'm a little judgmental, and I'm thinking you're teaching all these like 12, 14-year-old girls that weigh probably 70 pounds and eat a head of lettuce a day. That's their big meal, right? It's terrible, right? And she goes, oh, all the time. They're always passing out. So then I'm getting like nervous about these girls that are passing out. So I said, so what do you do when they pass out? She goes, oh, all set. And so she thought it was a trick question. And because she started to say, lie them on the floor. But she didn't want me to think she lied them truly on the floor. She goes, oh, we got these mats, and I put them on the floor. I don't really care where you put the person. The person is gonna pass out. I'm gonna guide them to the floor, clean floor, dirty floor, soft floor, hard floor. I don't care. I'm gonna put you flat to give you more oxygen. After that, if you have an infection from the dirty floor, I can fix it. So she was doing the right thing before she went to nursing school. Then she sort of kind of lost it a little bit. But I don't care about infection. Right this minute, I need you to have well-oxygenated blood. Lie the person flat. Okay? So this here, what did I miss? So this one here is a really, really big deal, because the test is about safe care. There are parts of the test that are about culture and spirituality, but the other thing is that pain in our world, the clinical world, people are obsessed about it. You gotta do the pain scale and joint commission. On this test, in general, pain is psychosocial. So if you have an ectopic pregnancy and the fallopian tube is gonna rupture and you have terrible pain, psychosocial, not my concern. But there are 3 pains I care about: cardiac, chest pain, heart attack, heart muscle, not getting enough blood, heart muscle can die. Compartment syndrome, cast too tight, broken bone, pain out of proportion, decreasing pulse. If we don't recognize this, the person can lose their leg. So that is a really big deal. So I care about pains that are C because of a lack of oxygen or a lack of circulation. And then sickle cell crisis pain. Pain in their arm because the cells are crescent shaped and can't flow. So this area is not getting as much oxygen. Painful. Those 3 pains I care about right this minute. I'm gonna do something about them right now. And the other 2 pains that are just terrible is burns and kidney stones. Like, I can't do anything for the kidney stone patient if I don't treat their pain, because they can't sit still, they can't stand still, and burns are terrible. So those people we care about, and these I care about because I'm treating the lack of oxygen. So just keeping that in mind. This one here, you can look this over. Remember, don't say why, don't say don't worry, don't pass the buck. So in general, there will be no calling the dietitian, no calling the clergy. I'm gonna do it all. I, the nurse, will do it all. I only call the doctor when there's nothing else that I, the nurse, can do. So I do have to make sure I gather data for the doctor. So when I call the doctor, I have data, but I can't deliver babies. I can't do surgery. So we'll call the doctor when there's nothing else I, the nurse, can do. And there might be some, yep.
So by that, do you mean that, like, in respiratory patients, like, we have respiratory, like, therapists who don't call them?
No, of course not. Oh gosh, no. You know what, you can do the oxygen yourself. You can suction the trach yourself. Oh my goodness, no. Passing the buck. Nope. And I would be very careful about answers that say respiratory therapy. If my patient is like short of breath and needs some oxygen, and they say, what would you do? And there was like an answer I kind of liked, and there was an answer that said respiratory therapy. I would not pick respiratory therapy because that is passing the buck. If the answer said give oxygen at 2 liters, absolutely I would pick that. So the word respiratory therapy is passing the buck. Yeah. So, yeah, so very carefully. So on this test, you're gonna do it all, and you'll know how to do it all. So the only time is when I can't, is when I have to call the doctor, and when I have to call my supervisor. So there are those management of care questions where I have to do the chain of command. So I saw someone stealing something, and normally in the real world, there's a part of me that would confront the person. But in this ideal perfect world, if I see someone who's stealing something, and they are not someone underneath me. So if they're someone from another department, or they're my peer, and they're stealing something, I call my supervisor. And you know what happens? I call the supervisor, and bing, there is the supervisor. Oh my gosh, hi supervisor. That's what happens. If someone below me, LPN or nurse's aide, is stealing or doing something wrong, I manage the team. I'm gonna speak to them. But I can't speak to other departments, and I can't speak to my peers. So I can't speak to another RN. Otherwise, I would call, chain of command, call my supervisor. People below me, LPNs and nurse aides, I will, confront them and do whatever it is I have to do. And that's kind of hard. We talk about that in delegation, but it's hard when I feel like I've worked with someone for a very, very long time and think that I can sort of trade jobs with like the nurse, and the other nurse can do something and I'll do something. It's truly about delegation, so you have to be careful. All right, just be careful about the accepts and further and all these types of things. I do say to study a little bit when you're studying, to look at things that say early or late. If something says early signs, you want to know them. Late signs, common signs, you want to know that. Okay? Always use the nursing process. Always do the safest thing. Oh, so look at this. If you have any question, if you have nothing else to do with your time, you're going to review inserting an NG tube, inserting a Foley. How much do I put the Foley in for females? 2 to 4. How far do I put it in for males? 6 to 7. So in the real world, when I put the Foley in, I hate to say this, this is what I do. I put it in all the way to the hub, to the 2 ports. That's what I do. Lots of people do that. They don't like that. You put it in as far or as long as the urethra is. Females 2 to 4, males 6 to 7. You want to definitely know how to give blood. You would like to be able to know all the IM locations, so you could do, like if they had to click on, you could click on to where the vastus lateralis is, and drag and drop how to do Z-track. They love central lines because it's an RN test. They love sterile technique. Oh yeah, so you know, I clean from in to out, right? I clean from in to out. And that's why I say that I might look at my procedure book, my fundamentals, and look at the procedures. Or do a couple YouTube things that, you know, just to break up your studying. This here is the therapeutic communication. Listen to the patient. Don't say why. Don't tell people what to do. Don't say you should, you cannot. If it were me, I wouldn't do those things. All right? And so when we get to the psych, we'll remind ourselves about the two types of psych patients. People like you and I have some type of stressor. Lose your job, lose a family member, lose your home. You're gonna stay with that patient. You're gonna allow them to talk and to ventilate. But if someone has a true psych disease, psychotic, schizophrenic, bipolar, crazy people, I want to be careful about their talking because I don't want to feed into their delusions. So I need to really try to redirect them as much as possible. So you know the good words. And again, you're not memorizing this, you just kind of flipping through this. The bad words. These are some things about the environment. Avoid the scatter rugs. So sometimes people leave the dog dish in the middle of the room because that's the way they've always done it. If you have somebody who's at risk of falling, the dish has to go against the wall so they don't trip over it. So here we go. And you want to assess what you see or hear, the blood pressure. Even though I didn't draw the labs are data. Lung sounds. Subjective, what the patient says. Objective, what I see. Intervention. Anticipate. Position, oxygen, IV. A recliner on this test is a big deal. Recliners make me sit up to breathe. Recliners can go 60 degrees. So if I just had hip surgery and I can't bend more than 60 degrees, the recliner will help me. So do people remember this question? Does this look familiar to people? So you said the nurse percusses the area over the right lower lobe. You get a dull, thud-like response. What is the nurse's best action? Knowing that on this test, action could mean assess or intervene. I feel like an action should be that I should be doing a dressing or an injection, but it could be assess or intervene. So you said to yourself, I'm not gonna waste time. Number one, is that an assessment or an intervention? Assessment. Number two, raising the head of the bed, assessment or intervention? Intervention. Number three, give oxygen, assess or intervene? Intervene. And document the findings. You said, is that good or bad? Bad, right? I don't know what's wrong about it, but dull, thud-like response, is that good or bad? Bad. So I can't pick number four. So then I said, wait a minute, because they're gonna get two for the price of one here. This is what's gonna send you forward, is that this person was percussing, and you said to me, physical assessment, inspect, palpate, percuss, and auscultate last, except the GI tract. So when you looked at this, you said, if I just percussed a problem, what would I do next? Auscultate, right? So there should be some system to this that you should be doing this over and over again. Topic, assess, intervene, and then what would I do? I would assess and find an A, a B, a C, or a D problem. And number one, is that an A problem, a B problem, a C problem, or a D problem? So I'm doing this on purpose, just to remind myself. This is my B, and this is my A. This is my A, airway, upper airway noise, stridor. This is my B, lung sounds, and oxygen. So upper airway, this is a B. Okay, alrighty, let's see. So we started at 4, we're here till 7. Why don't we take a break at like 5:15, does that sound reasonable? Because we want to get into the habit of taking a stretch break. We'll take a 10-minute stretch break, and we'll take one more 10-minute stretch break. This week, I already did. Let's come back to this. So I would say to people that this is a big deal. Always the airway, the breathing, the circulation, the brain. Everyone in the RN test has to pick the delegation answers about delegating to RNs, LPNs, and nurse aides. You have to prioritize. So let's say, because we might see some questions, let us say the 3 major things we say about prioritizing. If I want to take care of the sickest patient first, you say to me the sickest patient is a patient with an A, B, C, D problem, right? Airway, breathing, circulation to brain. And next I say to myself, from this handouts there, I want to say acute versus chronic, and I want to say change in condition. So those are the 3 major things we say about prioritizing. A, B, C, D, acute versus chronic, or change in condition. Oh, so sometimes I think that people really study, and they really study everything. But I don't have to study everything. But what I do have to study is infection control. So if you don't feel comfortable with airborne, droplet, contact, you really have to. You have to know what's involved in the airborne, what's involved in droplet, and what's involved in contact. So we do have a section that we do on infection control. But I'd like to just take a minute here right now and have you tell me what are the 4 major people that get airborne precautions. TB, good, yep. Measles. Herpes zoster. Yeah, herpes zoster, yeah. Chickenpox, yeah. So sometimes there's that thing on 411, nursing 411 is are you here for Nclex?
No.
Okay, yeah. Hi.
This is Nclex?
Yeah.
Oh, okay,
What-
they sent me the wrong room.
What are you looking for?
NUR 3110?
Oh, I don't know where that is.
Oh, it's such a-
It's not 205, and it's not 208. But I mean, if you go back downstairs, I mean, I think one stop's still open. Sorry. Okay. She didn't look like, she was kind of looking around. I didn't think that. So on nursing 411, or if anybody emails me, I'll send it to them. Is on nursing 411, someone did something where they have these 35 pages of bulleted pieces of info, and it's unbelievable, excellent. And so she did airborne, and she says, my chicken has TB. My chicken has TB. Measles, chickenpox, which is varicella, has HZ, herpes zoster, and then that looks like it is. That looks like, yep, very good. TB. My chicken has TB. Now the other thing is sometimes they don't say measles, and they say that other word for measles, which I think is rubeola, right? I think it's rubeola. Sometimes I forget if it's rubeola or rubella. Yeah, oh yeah, sure. But you don't, because you say rubeola has 1 L, measles, and rubella has 2 L's, and German measles has 2 names, right? And even though German measles is terrible, it is droplet. So if you own Airborne, I think it will help you for lots of other stuff. My chicken has TB. And so they'll be wanting us to make sure our infection patients are in private rooms in general. I could only be in a room with someone else who has my same germs. If I have varicella, chickenpox, and you have herpes zoster, shingles, can we share a room? You say to me, even though those words don't sound similar, are they the same organism? Is herpes zoster shingles the same thing as varicella chickenpox? Yes. So chickenpox people and herpes zoster shingles can share a same room. Now the words measles and German measles sound similar. Can they share a room? No, they're not the same organism. So they have to be in separate rooms. Alrighty? And so we'll go over that. We have a thing on that. So how about this question? What do you think on this one here? So this is a great question. Nursing diagnosis, medical diagnosis. Nursing diagnosis don't have medical diagnosis in it. So 1 and 2 are gone, and they're similar. So the answer has to be either C or D. And you said C is a physical answer before psychosocial. All of those things happen with a heart attack, but in terms of the nurse, what are we concerned about? Tissue perfusion. Yep, good. All right. I'm going to remind us about what I do first, assess. Unless the symptoms are very, very bad, then you do something. What do I do? Position, oxygen, IV. Okay, here's a good question for us. So it's supposed to be about 60 to 75 seconds per question, which sometimes is a long time. Chronic lung disease and hypercarbia. Increased CO2, not good. Oxygen, nasal cannula, 6 liters. You learned nasal cannulas can go from 1 to 6 liters. Okay. But I think I know something else. Respiratory rate of 8, good or bad? Bad. What's the nurse's best action? So if it's bad, would anybody pick A? No. Number 2 and 3 are oxygen answers, and number 4 is a position answer. So I always want to be careful because they're going to trick me. If I have 2 similar answers, get rid of them. Yeah. If I have 2 opposite, I want to kind of look at them more carefully. So when I looked at this question and said high fouls can be for respiratory or GI, and I had 2 opposite answers, and I know something about COPD patients, what's the only answer I can pick? Right? Because people who have COPD breathe from low levels of oxygen. The only amount of oxygen I should give them is 2 liters. So even though I kind of like this, I kind of hesitated because I know sometimes this is for GI. And I said, oh, and sometimes people want to pick C because they think, oh, they need more. But this group of people needs less oxygen. All right. So how do I know the patient's getting better? Evaluation and outcomes, we say. Here's one more question, then we'll take a break. So you take your time, you read the question. Sickle cell crisis, I don't know what that is. Oh my gosh, I don't know. Was given 4 morphine. I know what morphine is. Which of the following conditions indicates to the nurse that pain relief has been achieved? Is this question about a patient with sickle cell, or is this a question about pain management, that I, the nurse, am an expert at pain management? And I'm pretty good with morphine. So number 1, sleeping, assessment of a D problem. Number 2, blood pressure, assessment of a C problem. Number 3, assessment of a C problem. And number 4, subjective data. And so what's the only answer I can pick is number 4. Even though I know when patients aren't in pain, their blood pressure's okay, and their skin is warm and dry, the answer is D. All right? So why don't we take a 10-minute stretch break? Remind ourselves about the importance of stretch breaks. If anybody didn't sign in, if they can sign in. The Back Bay place doesn't have food anymore. So they used to have like a little machine, and you can get like snacks, and you can get juices and water and like soda. But supposedly the Back Bay one doesn't have it. So they do tell people that, and I tell people, this is not a day for a diet and not a day for a budget. So you bring food with you, you bring drinks with you, you bring another sweater, layered, they talk about layering, and there's a little, they give you a locker, you put your food, your money, your snacks in there. So that anytime you want to go take a break, you can just go in there real quick, take a couple gulps of water, put it back. They also, they're going to ask you to they're going to take your cell phone away from you. So what they do is they put the cell phone in the plastic bag, and they put it somewhere else. So I go in, and once I'm done, the sign in my life away, I put the stuff in my little locker, and then I come back up, but you've already given up your phone. So a few years ago, this person I knew, I say God bless her, she had failed the test a few times, and I knew her father, so we said we should help her out. So anyway, it's fine. So I thought she was okay. So she goes to take the test. She comes back and tells me 2, 3, 4 weeks she hasn't gotten her results back. So I think she's lying to me. And anyways, what happened was eventually she got a thing in the mail in 6 weeks. It said they forfeited her test. They forfeited her test, and she would not be able to take the test for 4 years. Yeah, oh yeah. So whatever, and so we don't argue with them about a thing. They want to think there's a camera in here, I'll take it off. Anything they tell me, I do, essentially. I have a cold, I'll use your tissues. So anyways, so what happened was that on her break, the 10-minute break, and she had told me this, she got her phone, made a bunch of phone calls to a bunch of people, me, her father, her boyfriend, her dressmaker, God bless her. And anyways, she just went on and on. And so it said on the thing that you don't use your phone while you're there. And they felt like if you use your phone, you could be possibly cheating, which I don't understand how you can really truly be cheating. And I believe in following the rules, but I did feel like they hadn't kept up with the real world. That in this day and age, everyone has, I mean, I shouldn't say everyone, but most people have some type of cell phone, sort of whatever. It's just kind of automatic to pick it up and start to look at it and use it. So we tried to do a bunch of stuff, didn't really work, but someone else had done the same thing and got a lawyer. And so that person got a lawyer, and so then they rescinded it and said she could take the test. But after that, then they said nobody can put their phone in the locker with their food. You have to put the phone somewhere else. So there's no temptation, because it's automatic. I mean, you just pick it up all the time.
It's not even in your locker anymore, right?
Right.
You don't even have access to it until you're done.
So you're done.
That makes more sense. Like,
Right, because
take it away.
you don't do it on purpose. You just pick it up automatically. So if they say to you, I mean, don't wear any jewelry, don't wear any special medals that you think are going to give you good luck because they're going to tell you to take it away. Camera. All right? Camera. I mean, this is what they think. And you know what? Whatever they want to think, I'll go right along with them.
Even at Ross, like, Even like a cross?
Nope, nope, camera. Yeah, go watching, yeah. So, yeah, you have to just, and like, whatever they say, okay, I'll do that, whatever you say. Okay, so let's do a few more questions, then get to some more stuff, and then I'm gonna bring those other questions out. So, this is kind of an interesting question about sickle cell, because I'm not sure I know that much about it, but just, yeah. Sickle cell, cystic fibrosis and hemophilia, common child diseases that have issues for us. They do, they have lots of issues for us as nurses. Okay, so now, patient before equipment. I'm gonna get rid of this one. Assess, oh, another sickle cell question. Oh, I don't know what it is, never took care of a patient with this problem. This could be an issue, right? But never is an issue. I'm going to identify the topic. So this is a tough question because I don't really know what sickle cell anemia is. Never took care of the patient, doesn't sound familiar to me. The patient has been hospitalized for another health problem and tells the nurse he's had an erection for over 4 hours. What is the nurse's best action? Knowing that action could mean assess or intervene. Number one, you said in terms of test-taking strategies, if you don't know this topic, you don't know anything about this disease, you say, I would never do number one. I would never tell anybody what to do. Number two, this is where I say, are they asking me anatomy questions on the state board? Sure they are. Here it is. They think I don't know the difference between the penis and the bladder. I mean, that's what, when they do this, they think I don't know the difference. And then I see two opposite answers. C says it's bad. There's nothing I, the nurse, can do. This is something the doctor has to do with the needle and stuff like that. Or I think it's okay. If you think it's okay, we pick C. If you think it's bad, you say we pick C. And so the answer is C, right? Vasoconstriction, blah, blah, blah. All right, now let's see. One more question. So if you get 3 questions in a row on the same topic, you have to say to me, identify the topic. These patients all have the same disease, but they have 3 different issues. So you want to make sure you identify the topic in this question here. So is this question about sickle cell, or is this question about infection? Infection. And what tells me about infection? So you said I'm going to identify each of the answers. Number 1, assess a temperature. Number 2, assess a B. Number 3, assess the liver. Maybe we can call it GI. And number 4, assess the skin of the lower extremities. And so what do we call a temperature? Is a temperature or fever? Is a temp of 100 a fever? No. I mean, this is like sometimes at 4 o'clock in the afternoon, my temp spikes. I don't have a fever. So it's not number 1, even though I was feeling nervous and I just wanted to pick the answer and move on to go answer more questions. Number 2 says decreased breath sounds unilaterally. And so could that be that my infection is pneumonia? Yes. So actually, what they found out from you is you know what a normal temp is, you know about pneumonia, and this These two things say I'm in the right room. This describes a person with sickle cell disease, enlarged liver, spleen, they get venous stasis ulcers. 3 pieces of information by this one question. And this is why no matter what I can do to up my knowledge, it's never gonna hurt. Because they found out 3 pieces of info, and this is why some people will pass at 75 and some will take longer. But I will tell you that statistically, people, the most common number of questions people get on the test is 120. So people can come back out and tell me that they got 75. I don't believe everyone got 75. They say, those people that know, say the most common number of questions people get is 120. So that's 2 hours. You know that you're gonna be in there for at least 2 hours. All right, I'm gonna get rid of this. Oh, the answer was, what's the answer? B, diminished breath sounds. Yeah. Okay. Now, this here is very important. That if you can't do fluid volume deficit and overload, and you can't do endocrine, they will get you. So everyone gets an endocrine question, I just don't know which one you will get. So that's why I have them all out here for us to look at. So and then you have to know the traits and suggestions, we'll come back to it. So let's look at fluid volume deficit. And you say to me, fluid volume deficit? In a sense, a lot of the stuff, the blood pressure's down, and that's CVP. We talk about it a little bit in school, very, very important. It does tell me about fluid states. So the normal CVP is 4 to 10. Normal CVP for most people is 4 to 10. Here's a nice little assessment of fluid volume deficit, blood pressure down, pulse is up, and respirations are up. So the lab, yep.
What's a CVP?
Oh, that's a good question. It's called central venous pressure, and it talks about the pressure in my major organs, my heart and lungs. So in general, if my CVP is down, fluid volume deficit. If my CVP is up, fluid volume overload.
Thank you.
Yeah, okay, good. And so look at, if I'm fluid volume deficit though, and I've vomited and I've got diarrhea, all my fluid is on the floor. There's very little fluid in me, so I have more particles than water. So really, in terms of fluid volume deficit, everything is up except my blood pressure and CVP. If you can know that, it'll help you so much in answering questions. So blood pressure and CVP are down, everything else is up. Pulse, respirations, and labs. And the creatinine is normal. The BUN is up, the creatinine is normal. Fluid volume deficit.
Which ones are gonna be going up, the BP and the what?
BP and the CVP are gonna go down, right? BP and CVP will be down, but my pulse, my respirations, my labs will be up. And my creatinine, the BUN will be up for dehydration, the creatinine will be normal. And the specific gravity will be up. So what's the normal specific gravity? So 1.010 to 1.030. So sometimes I say 1010 to 1030. So we'll see if we see that somewhere. Here's the causes of fluid volume deficit. And I think that people knew this before nursing school, but keep in mind the NG tube is going to cause people to get fluid volume deficit. So we'll ask a question, or I'll ask a question right now. If I have a lot of stuff coming out of my NG tube, what will my blood gas be? If I have a lot of gastric acid content coming out of my stomach, what does that make me? Alkalosis, and because it's from my stomach, and not my lungs, metabolic alkalosis. Good. So look at fluid volume deficit, supine, modified Trendelenburg, oxygen, fluids, packed red blood cells, or this thing called hetastarch. So every new review book since 2010 has had hetastarch in it. It's some type of clear fluid in a bottle. We give it IV, and they say it's a volume expander. So it would make sense to me that if fluid volume deficit, I would like a volume expander, hetastarch or Hespian. Now there's some patients who really like hetastarch or Hespian. So if I was bleeding, I would like some blood. Bleeding, give me some blood. But there are some people that say, I'm bleeding, don't give me blood. So who would like hetastarch? What patient? Jehovah Witnesses. Jehovah Witnesses, yeah, right, that's okay.
Wrong one.
Right. Well, since it's a Catholic school, we understand. But since you just, did you say Jewish kosher?
I know where I was in the J, I just thought it was Jews right away.
It's okay. But we want to remember that we're gonna talk about Jewish kosher in terms of diets, that we have to know the diet for Jewish kosher. And what is the diet for Jewish kosher? No meat and milk together, no shellfish, and no pig. So we say that a lot, I say it a lot, no pig, no shellfish, but I have to remember all the stuff that comes from a pig, because a lot of stuff comes from it. I think, I'm not sure about this, but I think that in Israel, there is no pepperoni pizza, and I bet at McDonald's, there are no cheeseburgers. Would you agree? If you go to Israel, Jewish kosher, do you think McDonald's has cheeseburgers? No, because they don't do meat and milk together, right? I had some meat. I can't have milk for 1 to 6 hours.
Wow.
Yep. So do you think they have pepperoni pizza? Cheese is milk, right? No pepperoni pizza. Okay, so here's this fluid volume deficit. Here's fluid volume overload. So what I tried to do here though, was say, some people feel really good about fluid volume overload, heart failure, etc. But you want to know that if they have frothy secretions, you're gonna have to suction them. Oh, a procedure. So I put some extra junk in there, and I would say that people would say, I know you're supposed to pre-oxygenate people before you suction them, but could you, off the top of your head, say what you put the suction on, okay? 80 to 120. If I suction patients, I do 80 to 120. When I hook up the NG tube, how much suction do I put on the NG tube? 80 to 120. This is the junk they're looking for from you. I sort of say junk, but this is the other piece of that knowledge that they want you to know that maybe I don't think is that important sometimes.
Are you gonna, you're gonna
Yeah,
update
yeah,
on
yeah,
the
yeah.
2020 review section?
Yeah.
Okay, thank you.
Yeah. And so look at fluid volume overload, everything's up. Blood pressure, pulse, respirations, and CVP, up. Now you said that to me, you said all my vitals are up because I'm a bucket of water. So what are my labs gonna be? Down. Labs are down because I have so much water. I only have a couple of particles. Look at. All right, I got all that water and just a couple of particles. There's my fluid volume overload. So I just try to stick stuff in here that I think is important. Fluid volume overload, sit the patient up. Not low, because that's ICP, semi-Fowler's, then high. There's the oxygen, and there's the Lasix and furosemide, humididine. And if my patient is fluid volume overloaded, and I give them Lasix, how do I say I know the Lasix is working?
Lung sounds.
Oh,
A B answer. I'm exhausted from emptying the Foley. I'm exhausted from emptying the urinal. But is that how I know the Lasix is working? No. Clear breath sounds is how I truly know it's working. What lab is low when I give Lasix? Potassium. And does potassium affect my heart? Yes. Okay, good. So on here, at some point I might fix this. They love on the test ICP. So I have the position for low Fowlers for ICP. And you say to me, if they have ICP, no coughing, no deep breathing, no incentive spirometer, no strong narcotics, because I don't know if they're sleepy from the narcotic or sleepy from ICP. All right, what's the earliest sign of ICP? Change in mental status. What's the earliest sign of hypoxia? Change in mental status. What's the earliest sign of hypoglycemia? Change in mental status. What's the earliest sign of hyperglycemia? Change in mental status. What's the earliest sign of a UTI in old folks? Change in mental status. Right? There are 7 things. The earliest sign, change in mental status. Restless, anxious, confused, picking at the bed covers, talking to the wall. All those things are it. Okay. And the earliest sign of dehydration? Change in mental status. Okay. So this is good. Oh, here's my flowing water. So this one here is ADH, comes from my head. And so we want to know the diabetes insipidus. If someone asks me about diabetes insipidus, I say DI is DA. And the patho for that is that there's a decrease in ADH. And this is why I say pick apart the words. Decreased against diuresis means I am peeing. Clear, dilute urine.
is this doing Foley's class?
No, we don't know where that is. Someone else came.
It is on there 5 to 8, 2 to 5, 205.
2110, okay.
Yeah, we
Thanks,
don't know.
Catherine. I'm sorry.
That's
I
okay.
think it's online.
I know, but I know usually, I know it's online, but maybe the first week they meet, I don't know.
Okay,
Yeah.
all right.
So DI, decreased ADH, you peeing. I mean, I don't need to absolutely know this, you pee. You pee somewhere between 4 to 24 liters of urine in 24 hours. That means you could pee a liter an hour. You say to me, why have they asked me so many of these questions? Because they're gonna find out about DI and fluid volume deficit. So look, clear urine, it looks, the specific gravity is down, the complication is dehydration, put the patient flat, and if they have a decrease in something, give it to them. When I go to the med room though, I don't find ADH. I have to find Potassium, vasopressin, or this DDAVP intranasal. What causes this that we should know is neuro and lithium. So neuro problems would cause this and lithium. So I know I'm supposed to know about lithium. Normal lithium level, 0.5 to 1.5. People on lithium have low sodium. I say give them potato chips. And people on lithium need lots of liquids, right? If I went to give my DDAVP intranasal, what would make me stop and say, I don't think this is gonna work today? What would my patients say when I go in with my intranasal med that they've been getting every day? Intranasal. What would make me say, ooh, is this gonna work? Stuffy nose, sinusitis, bloody nose, any type of drainage. And so it's not that they want you to know a ton of stuff about DDAVP. They wanna know when you go to give an intranasal med, do you know if it's gonna work or not? And if this is all blocked up, it's not gonna work. Alrighty, so this is a big deal. Now sometimes, I say this is like the 2 Ps, polyuria and polydipsia, because it's not 3 Ps of diabetes mellitus. And the reason I sort of know that, even though this urine looked clear, I hate to say this, I sniffed the urinal. And if this was diabetes, wouldn't this smell fruity? This is not about the pancreas. This is not about the insulin. If you got a diabetes insipidus question and you said, I can't remember, you're gonna say to me, the one answer I won't pick, they might wanna trick me, I am not picking any answer that's about sugar or insulin. This diabetes insipidus, flowing water, diabetes mellitus, flowing honey. So if you don't remember this, don't pick sugar or insulin, because it has nothing to do with the pancreas. My head.
For diabetes insipidus?
Yeah, only has to do with my head, flowing water. Don't pick, so they try to trick you by saying check the glucose, do a finger stick, never. You are gonna check for dehydration. So here's the exact opposite. SIADH, increased ADH. And look who gets this, neuro patients and cancer patients. It says increased water reabsorption. You say to me, fluid volume overload. All the vitals are up. They've got bilateral rails. They're a bucket of water with a couple of dots of salt. So their vitals are up, but their labs are down. We almost do the same thing we do for fluid overload. You sit them up, shut off their IV fluids, and give them Lasix. So remember, Lasix can cause my blood pressure to drop. It can cause low potassium, low sodium, low mag. So I put here that when my sodium is low, my calcium is low, and my mag is low, I am at risk of a seizure. Tremors, twitching, tetany seizures. Those are all what I call D answers. When my potassium is low, K, I am weak. W-E-A-K, weak. When my potassium is high, I am weak. K, weak. W-E-A-K. So somewhere we might see this again, where we talk about the potassium, low potassium, flat T waves, and a U wave. High potassium, high K, high T. Those are RN stuff, and we do have that somewhere. So if I know that Lasix causes me to lose a lot of stuff, it loses sodium, calcium, and mag, and potassium, which one would you treat first? You say to me, I'm gonna treat the A, the B, the C before the D. So even though these cause D problems, I need to treat the C person problem first. Treat the potassium. Yep. Let's see. Here's the thyroid, hypo and hyper. And so this one's easy, I think, hypo. Everything is down except my weight is up. And one more thing is up with hypothyroidism. My weight and something else is up. Cholesterol. You can't metabolize anything. So you hold on to fat and cholesterol. We give Synthroid for this, and you check the pulse before you give it. If it's over 100, we're gonna hold it. So Synthroid we give every morning to get me sort of going, but if the pulse is greater than 100, the patient should call the doctor, and we're gonna hold it. Now, hyper is, everything is up, except my weight is down. And there's the med, PTU and Tapazole. Those are the two meds for hyperthyroidism. Now, if everything is, if I'm hyper, oh, there's my little cow. You know, calm as a cow, right? They don't do too much. Stand, sit, sit. All the other animals run around. So, here's the deal. If I have hyperthyroid, we say, take it out. So we can take the thyroid out because you can live without it. But look at this post-op day 1 and post-op over here. This is all of my post-op patients, right? And that one over there is specific to the thyroid. They just manipulated all of this stuff. They just manipulated here. Stridor, swelling, airway problems is what we would say. And then the bleeding. And how do I know the patient with a thyroid surgery is bleeding? No. That's tonsils. This is here. So this is gonna be your neck is gonna get bigger, right? Increased size of neck, right? If you look at the back of the neck, you might see the blood dripping, but the neck is gonna get bigger, is what we would say. So swallowing is my tonsils. That's an airway problem. And they could get, even though they took the thyroid out, when they took it out, the hormone dropped into the patient. And so they'll be there for a couple more days. And so that's a tough one because the patient says, I can't live this like this being so hot and having palpitations. So even though there's no thyroid, we are gonna give this patient PTU, Tapazole, and something to lower their heart rate. When they go home though, what med will the person go home on who's had their thyroid out? Synthroid. Yeah, right, Synthroid. Day 3, we worry about that they nicked the parathyroids, low calcium seizures. So what are the 2 tests that you can do to say the patient's calcium is low? Trousseau's, the blood pressure cuff, and facial nerve twitching. Those 2 things will tell me that the calcium is low. Yeah. And if my calcium is low, what are you gonna do? Give me calcium. Right. Alrighty? Oh, so what do you think's coming next? Diabetes. Okay. So here's one thing about diabetes. Quick and fast, restless, cold, and clammy. You want to give them 50% dextrose, IM to sub-Q glucagon, PO glucose. And so on this test, the PO glucose is going to be skim milk or apple juice. Okay? You do whatever you want at your house if you want to give them OJ, but we're going to give skim milk or apple juice.
To treat what?
Hypoglycemia. Hypo. Skim milk or apple juice. If the patient says to you, I only have whole milk, nurse, or apple juice. You have whole milk and apple juice. Which one are you going to give? Apple juice. Because what's in whole milk? Fat. It will take forever to absorb. So if the blood sugar is low and we want it to go up now, we're going to give them some type of simple sugar. Skim milk or apple juice. Yeah. And for hyper, people are lethargic. You want to give them insulin. And it should be that we're going to give regular insulin. The only insulin we can give IV. Regular insulin peaks in 2 to 4 hours. Regular peaks in 2 to 4. When does NPH peak? 6 to 10, 6 to 10, 7 to 10. So this is what I say about NPH. It peaks at change of shift. 6 to 10, right? Change of shift. How about that one that's called glycine lantus? No peaks, right? Glycine lantus has a steady level. I can eat whenever I want. So here is the thing that's probably the most important thing about the insulin, or about the blood sugar, is I have over there hypo, because it's so quick and brain cells die, they want to make sure that you can recognize this. So to prevent hypoglycemia, you give them a complex carb, peanut butter crackers, apple, cheese, and to treat. So if they become hypoglycemic right this minute and you want to do something, you give them skim milk or apple juice. Now that's not bad, you say to me, I know that, but of course they're not going to say it that way on the test. So what they're going to do is they're going to say something to you like this, where people exercise too much exercise, or you eat too little. So exercise too much, jog, run, work all day, emotions, have a fight, and then if I don't eat enough, no eat, forget to eat, NPO, or you vomit. Those things are what's going to cause me to become hypoglycemic. So this is a beautiful slide about hypo and hyper, and what you do for this to treat and to prevent. I did put in there this Gorgonzola cheese. The reason I put that in there, I shouldn't say it's a funny cheese, but it is a different type of cheese. I've seen it in a number of review books, and it's some cheese they make in northern Italy, and this is what they do to it. It's soft. And so, because oftentimes people think soft cheeses are processed, and they contain a lot of salt. But this is a soft cheese that they make special, and they got this metal rod, like not a little bit bigger than this, and they stick it in the cheese. They stick it in, and it leaves a hole there. And guess what grows in that hole? Fungus. Oh yeah, it's supposed to be delicious. But you say to me, why do I need to know that? If I know that this cheese grows fungus, who do you think shouldn't get it? Maybe because they're at risk of infection, you're right. Who's even more at risk of infection? HIV, cancer, chemo patients. And sometimes it sounds like a silly thing to me, but it is, meaning that this cheese is going to make me more sick. So anybody who's immunosuppressed should not get this cheese. Okay. You recognize this being Mr. JFK? I gotta fix this. There's a typo there, JFK. But here he is. Here he's kind of sickly. There he's there where people say, oh, he's from Cape Cod with a nice little tan. I'm from Cape Cod. Right? But really, it's Addison's. Eternal tan. So, this they love because it's fluid volume deficit. And so look at a lack of salt and water, shock. Lack of sugar, coma. A lack of steroids. How do we fix this, Addison's? You add S's, saline, glucose, and steroids. And you have to worry that they have high potassium, high K, high T, low pulse. So I tried on here to kind of keep adding to stuff. So look at what's underneath here. If your potassium is high, K-exalate, regular insulin, D50, sodium bicarb, calcium gluconate. And they are at risk of infection. This will be questions that we'll see that they want you to decide what, if this person can have a roommate or not. So there'll be some people that cannot have a roommate. These people are sort of at risk of infection. We're gonna be cautious about their roommate. There's gonna be no pneumonias, no draining wounds for their roommate. It's gonna be somebody, they say, like who has MS, someone who has lupus, a fractured hip, because those people in general don't have infections. MS, lupus, fractured hip would be a good roommate for this person. I wouldn't invite them in here with us because we have too many germs. There's too many of us, we've got germs.
Why are they at a risk for infection?
They're at risk for infection because they have an autoimmune disease. Autoimmune makes me an increased risk of infection, and we're giving them steroids, and steroids make me at risk of infection. So we're just gonna do one more slide, then we'll take a break, and we'll come back and do some beautiful questions. So here's the other side of Addison's, is the Cushing's. Again, they love this stuff because it's a disease, it's a medication. So I think I put a lot of stuff on here. And so I think that I sort of think I know what I did. So in the first couple of slides, there was something about low potassium, but I didn't say what it was, to sort of make you think. Then as you go further, I've got the answer. So low potassium, flat T's, U wave, abnormal pulse. I say Cushing's is Humpty Dumpty. You know, buffalo hump, truncal obesity, falls off the wall and breaks their bones. So they love endocrine, they love fluid volume deficit and overload, and they love the trach and the chest tube. So there's Humpty Dumpty, falling off the wall. All right, so here's one question here, and then we'll take a break. So at home, unless I'm taking a time test, I don't worry about the time. I just want to learn to answer the questions. Use the strategies, identify the topic, assess before I intervene, physical before psych, A, B, C, D. So I want to just feel like really good about how to answer the questions. Then later, if I need to work on my speed, I'll work on it. So 3 hours after surgery, you note that the breath of a person who's type 1 diabetic has a fruity odor. And I'm thinking to myself, diabetic ketoacidosis, because I know stuff. And normally when the patients say that, I say, ooh, DKA. And what's the nurse best first action? So number 1 says increase the IV. You say maybe. Number 2 says test the urine for ketone bodies. Interesting, assess. Number 3 says document, which means you think it's okay to have a fruity odor to your breath. And number 4, intervention. So it's kind of a funny question in some ways because we maybe don't do this a lot in this part of the country. But I do know that the urine sometimes comes back positive for sugar or acetone. I know that we test the blood sometimes for ketones, diabetic ketoacidosis. So that fruity odor is on burning fat. And so when I looked at this question, B was the answer. It was the assessment answer that I could say this person truly has ketones and they've started to burn fat. Okay, great question. You weren't sure, but you did know diabetic ketoacidosis. You see ketones, or you said 1, intervene, 2, assess, 3, not normal, 4, intervene, 2 interventions, 1, assess. What do I pick? Assess. If there's 2 similar answers, get rid of them. You can't be blue and cyanotic at the same time, okay? You've got to find another answer. Even though blue and cyanotic is bad, you want to find a different answer here. So take another 10-minute stretch break, and it's 6:13. If we come back at 6:25, I've got these great questions. SE questions. We will go around the room.
Oh, no.
Oh, yes. And it'll be like you 2 are going to answer it. You 2. We'll do 2, 2. Okay?
Okay, we'll start from the back.
Oh, well, it's easy if I start from the front. So here's the first question. Can you see it? This, yeah.
A nurse is working with an occupational health clinic when an employee walks in and states that he was struck by lightning while working in a truck bed. The client is alert but reports feeling faint. Which assessment will the nurse perform first? Pulse characteristics, open airway, entrance and exit wounds, or cervical spine injury?
Yeah. So in terms of identifying the topic of the question, what's the biggest issue up there that's in that stem, would you say?
Priority that he was struck by lightning.
It's a possibility. It's a possibility. That makes me very nervous. But what's he complaining about?
Oh, that he's feeling faint.
Oh, and is that an A, B, C, or D problem?
C.
Faint and feel like you're gonna pass out is a C problem. Oh, C problem, okay. So now, when you looked at the choices, were they assessment ones or interventions?
Assessment.
Okay, so what was number one?
C, pulse characteristics.
Okay, what's number two?
A, airway.
Yeah, three?
It's entrance and exit wounds.
Yeah.
And
And
then
four.
for cervical spine
Yeah.
injury.
So what's the answer?
A.
A. This is a beautiful, beautiful question, because I do know that when people get struck by lightning, they have entrance and exit wounds, and that's helpful to know some things, and I could worry about those things getting infected. I also know that when people get struck by lightning, sometimes it's really, really bad. But is this, an airway and cervical spine go together? They're very two similar things, like any type of trauma patient with like airway / cervical spine, two similar answers, I would say. And so when I looked at this question, even though I wanted to pick airway or cervical spine, I said to myself, he's walking in and he's talking. So that piece of my assessment is done. And what is the patient complaining about? Faint. So identifying the topic is so, so important, because I could have got myself all caught up in the lightning and the wounds and did he pass out in the neck and all that, but the complaint after getting struck by lightning is faint, which you say to me, I'm an expert at people who faint. And so, C problem, lie the person flat, blah, blah, blah. Okay, good. Now, the next one, we'll come over here to this table here, and we'll see what this question is here. Because I'm looking for central line questions, and look what's up here. But if Hesse says it's something, it's important, whatever they say. Hesse, Kaplan, ATI, whatever they say, we agree with them. All right, so we'll leave it for you two. One of you can tell us the answer.
When bathing an uncircumcised boy older than 3 years old, which action should the nurse take? A. Remind the child to clean his genital area. B. Defer
Perineal.
that care because of the child's age. Retract the foreskin gently to cleanse the penis. Ask the parent why the child is not circumcised. C.
Yep. So is this question about circumcision, uncircumcised, or is it also about growth and development? So there's a couple of things here. One, you can't pull the foreskin back till they're 3. At 8 to 9 months, you can do a little something, but not till 3 fully. So by 3, it needs to be cleaned, infection. And then you said, well, I should be teaching my child to be independent. But can I really think that I could ask a 3-year-old to do this? No. So this says them that you know your anatomy, you know growth and development, and you know the issues about infection. And we would never say to the family, why? Why did you do this or why did you do that? So, like I said, I would expect central line questions, but this is about growth and development and the future in terms of infection, that you know the importance of keeping things clean. Okay, all right, let's see the next one. All right, let's see, we'll do the next row. Okay, yeah, oh, you're by yourself.
That's okay. The nurse manager of a skilled nursing chronic care unit is instructing UAPs on ways to prevent complications of immobility. Which intervention should be included in this instruction? A. Perform range of motion exercises to prevent contractures. B. Decrease the client's fluid intake to prevent diarrhea. C. Massage the client's legs to reduce embolism occurrence. Or D. Turn the client from side to back every shift. I would say A.
So what was the topic here? They were looking for complications of immobility, right? So I think it's A, right? We agreed that everyone thinks it's A?
Yes.
Why isn't it B? What was wrong with B? You know, I mean, the person having diarrhea, are you gonna decrease fluids? No. So is this finding out that you know about fluid volume deficit? Yeah, so that's good. What was wrong with what was wrong with number 3? And what was wrong with number 4? Yes. Yeah, so I think that this one D is really important because sometimes people just read it and say, oh, turn and reposition. But you would never do, and this is the ideal perfect world. We have all the time in the world. Everything we're gonna do every 2 hours, vitals, toilet people, check on them, turn, reposition. Yeah, so good, so that's a good question. So we'll go to the people, that there's 3 people, 3 of us can have the choice on this question here.
The nurse is instructing a client with cholecystitis regarding diet choices. Which meal best meet the dietary need for this client? A steak, baked beans, and salads. Boiled fish, green beans, and an apple. C, pork chops, macaroni and cheese, and grapes. And D, avocado salad, milk, and angel food cake.
So if I'm a little concerned about diets, which we're gonna talk about, like the gluten-free and things like that, I would pick the healthiest thing up there. So what is truly the healthiest thing? Not what you like, but B, yeah, absolutely. I mean, steak, baked beans, and a salad, not bad, but steak is red meat, so that's probably not, we'd pick things like chicken and turkey. So I think it's B. Pork chops, macaroni and cheese, I'm not sure. And avocado salad, milk, and angel food cake. I mean, there's no vegetable, whatever, yeah, no protein. Yep, question?
Cholecystitis, is that the,
Oh,
what part is that again?
is that inflammation of the gallbladder?
Gallbladder.
Is that
You
if,
wanna stay away from the fat.
and you wanna stay away from fatty stuff, and I think avocados and macaroni and cheese.
Yeah, no pork, no cheese.
Yeah, so I would say that gallbladder people, fat, you know, we don't want any type of fat stuff, right? But I would always try to pick healthy stuff. And see, I would have, when I read this question, I would have said cholecystitis, inflammation of the gallbladder, which would make me think fatty foods, right? Okay, and so we're gonna do gluten-free, you know, and we're gonna do gout diet and such. So, okay, that's the next, so let's see. We're gonna do, so we're not gonna do, we're gonna do this next one here, this one here. So this is a select all, let me see. Do you feel, would you mind doing it?
Which steps should the nurse take when administering ear drops to an adult client? Select all as applied.
Mm-hmm.
A, place your client in a side-lying position. B, hold the auricle upward and outward. C, hold the Doppler 6 centimeters above the ear canal. D, place a cotton ball into the inner canal. And E, hold the auricle down and back. So I would say A.
Yeah, so we always look at the position answers and we say, is it good or bad? So we think it's a good position, yep.
I would say you want to hold the dropper above.
What did you think about B?
Oh, B, sorry.
Yeah, right.
That one. Upward and outward is for shedding.
No.
No, opposite.
Yeah.
It's down.
So the adult is you up there, you up, and the child is D down.
Okay.
So are you gonna pick number 2? You're gonna also pick number 2. So you picked 1 and 2. We'll stop there for 1 minute. Do you would you pick number 5, E? If you picked 2 for the adult, would you pick number 5? So that's gone, right? So now we're left with number 3 and number 4. There's a little bug here flying around. So I don't know on number 3. This is a tough one. I can't remember if 1 inch is 2.5 centimeters right, I can't. Or if 1 centimeter is 2.54. I think it's 1 inch is 2.54. I'll do that. So 1 inch is 2.54. What's 2 times 6? And this is what you want to do on the test, right? See that fly still? Or whatever it is here. Look at 2 times 6 is 12, at least, right? Here, bing! Am I going to be able to get this? Okay, right? And sometimes they just want to know that you have common sense. How about 3?
That is the.
No, it says 3. Oh, yeah, 4. What about 4?
No.
Can any of us put anything into the inner canal unless we break the tympanic membrane? So again, so a little anatomy and a little knowledge here. So the only answers you can pick is number 1 and 2. All right? Right? It's the only answers you can pick.
But 6 centimeters is only 2 inches.
Oh, look, no, it's 1 inch is 2.54. 1 inch, 2.54. So 1 inch is 2.54. So 6 centimeters is what, 2 inches? Again, who cares if it's 2 inches or 12 inches? Do you think you're going to try to put eardrops?
Right on it.
I think I would come right close to it, right? Because even if I'm doing 2 inches, do you think I can get that in there? Do you think? I think once I'll do it.
What is what
Yeah.
they're saying, like an inch within
Yeah.
an inch? Like,
So would
how
you,
are they-
even if you did an inch, do you think you're always going to get that in the ear? I mean, I'd be coming pretty close here.
No, so what I'm saying is,
Yeah.
is it pretty much like you're almost like in
In
the
the ear,
ears?
yeah, absolutely.
Is it right on it?
That's right. So either whatever way you did the math,
So kind of like any measurement wouldn't even
it
be
wouldn't
there.
matter when they're trying to trick me.
All right, that's bizarre.
Right, they did. Sometimes they trick me like that, yeah. Okay, let's see. All right. Let's see who's gonna be next. You two, one of you?
Yeah.
Okay, Felix.
Venous identifies a potential for infection in a patient with partial weakness, weakly and full weakness that happens. What intervention has the highest priority in decreasing the client's physical infections? A. Administration of plasma expanders.
Mm-hmm.
B. Use of careful hand washing technique. C. Application of
So what's the topic? What's the priority here? What's the topic here? Infection. Are you an expert at infection? You might not. I don't know if you're an expert at burns. You can tell me later if you're an expert at burns, but I think you're an expert at infection, aren't you? Yes. Everyone else said yes. They think you are, right? Aren't you? Day 1, nursing school.
Yes.
So what's the only answer you can pick here? Wash hands, yeah. Now, they did try and trick me by talking about the cream, the antibacterial cream. And yes, burn patients, we do put cream, antibiotic cream on them. But is that truly going to be the way to decrease the risk of infection? The number 1 thing is hand washing. Now, what was it about number 1 that they put that there to trick us? Plasma expander. My head is touch. So burn patients over time go into shock, and they need number 1. But the question right now was only about infection. So I don't feel like I know a lot about burns, and I'm getting myself nervous. But was the topic about burns, or was the topic about infection? And what are you an expert at? Infection. Yeah, so it's hand hygiene, first day of school. Okay, let me just see. I just want to get some good questions. Let's see, I'm gonna make these questions bigger.
The master list of something.
Okay, so what's this next question? What do you think about this question here?
In taking a client's history, the nurse asks about stool characteristics. Which description should the nurse report to the healthcare provider as soon as possible? dark black sticky stool daily. Daily dark brown stool. Firm brown stool every other day. Soft light brown stool. So the dark black, that's bloody, sticky.
So that's telling me that the patient possibly could have have bleeding. And if it's dark and sticky, is that upper GI or lower GI?
Upper.
Upper. If it's lower, it has to be bright red blood. The upper, it's mixed with gastric acids. Now, if the patient did call me and say, nurse, I've got these dark black stools, would I get nervous?
No.
I might get nervous, but in order not to be nervous, what would I say to the person?
If they're on any medication.
I'd ask what meds they're on. I might ask them to describe the stool, because if they're on iron, will the stool be sticky?
No.
It won't be sticky, will it? What will the stool be if I'm on iron pills? Babies or adults? Will my stool be soft and sticky? Or will my stool be firm and constipating? So the consistency of the stool, black, hard stool, is gonna say to me, iron. When I give iron pills to people, what do we give it with? To increase absorption? Orange juice. Oh, so I think it's orange juice to increase absorption. If I give stuff with milk, what does milk do? Decreases, right? Milk neutralizes stuff. So if you don't want them to get something, give it with milk. If people accidentally take too many pills, give it with milk. Yeah, okay? Good. If you have liquid iron, how do you give liquid iron? Straw, yep. Okay. Okay, here's a question. What do you think about this one? Whose turn is it? Up in the back? Okay, good.
In completing the client's preoperative routine, the nurse finds that the operative permit is not signed. The client begins to ask more questions about the surgical procedure. Which action should the nurse take next? A, witness the client's signature to the permit. B, answer the client's question about the surgery. C, inform the surgeon that the operative permit is not signed and the client has questions about the surgery. So I'm going with C.
Good job. Right, now, when would A be correct?
When they're doing the procedure of risk and telling, well, basically when they're doing that education about the risk and things like that.
Once you determine that the clients understand.
Yeah, so I would pick A if this question here had said the patient understands what the doctor told her or the person who's doing the procedure. So whoever doing the procedure will provide the info. All I do as the nurse is witness that Mary Brown signed the consent form at 6 p.m. tonight. So I can prove that. And I have to think she's competent. So if she feels good about this, I can just do A. But she didn't feel good about it, so I had to call the doctor back and say we need to do something. So this is one of those management of care questions that they think is important. And you want to make sure that the person is competent, and that if they're not competent, we call for help. But if they are underage, so minors, so who's an emancipated minor? Yeah, so I have a bunch of M's. Emancipated minors are people who are married. So you can be 14 and married. It's people who are I say anything to do with maternity. So it means pregnant, miscarriaging, abortions, birth control, anything to do with that, you can be emancipated. So married, mothers, maternity, and then one more they say is if you're financially independent, so you pay your own bills. So I say money. So married, mothers, anything to do with maternity, and money. And the fifth one, which doesn't happen as much anymore, is people used to be able to lie, do something to their paperwork, and you can be 16 and join the military. So if you're nowadays you have to be like 18, but something military people could be 16. All right. Okay, let's see what we have for a couple more questions. Oh, let's see, so this one is a little bit of, this one's kind of funny to read, so let's see. No, it's a good question. This, you're assessing this person. Okay, oops, two people.
So is it the nurse is assessing?
Yep.
them? The nurse is assessing several clients prior to surgery. Which factor in the client's history poses the greatest threat for complications to occur during surgery? A, OCP, B, anticoag, C, antibiotic, or D, laxative?
Yeah,
Is OCP over time?
no, it's, birth control.
Oh.
OCP or BCP, oral contraceptives. So would you say that every answer is an assessment answer?
Yeah.
There's no interventions. So when you look at the assessment answers, I always get it down to two. I'm on my fence about two. Would you agree? So I'm gonna say to myself, on these questions, which one of these meds truly can cause an A, B, C, D problem? Especially if I'm gonna have surgery. B, right. So post-op, A is an issue, because I mean, A can cause me to get blood clots. But this is talking about prior to surgery. So really reading the question, prior to surgery, what would I be concerned about? Patients who are on meds that make them bleed. After surgery, I would worry that who's at increased risk of having issues would be the person who's on the pill that they could get a PE. Yeah. And antibiotics, things that we do after surgery. And when do we give laxatives? Before surgery, right? Sometimes we give laxatives before surgery to clean them out. But that's not probably a big a deal as bleeding. Yep.
So with the birth control, you'd even be more concerned with them bleeding out than having the clots?
Well, see, it's before surgery, right?
You wouldn't have to worry about it.
No, I would worry about that if they had said the patient had been on bed rest for 3 days, that would be different. So I have surgery and now I'm sort of decreased activity for the next couple of days. I'm worried about that. I'm going to be worried about a blood clot. But right now, the greatest risk for complications to occur during surgery, right? I had to really read this question. So during surgery, you're not going to get a blood clot because you haven't been immobile that long, but they are cutting you. And so if you're on blood thinners, are you at increased risk of bleeding? Yeah. And everyone feels comfortable with the antidote for heparin? Antidote for heparin? P, heparin P, protamine sulfate. The lab test for heparin? PTT. Antidote for Coumadin? Okay. Lab work for Coumadin? Yeah. Antidote for aspirin? No. People say no. You can say no. No med. If I went to surgery and I was on aspirin, is there anything they could possibly give me to stop bleeding? Even though there's no medication antidote for aspirin, what might they give me? If I'm having surgery and I'm bleeding, and I've been on an aspirin product that does something to my platelets, right? Prevents them from clumping together. So would they give me platelets? Would they give me a blood product called platelets? Or fresh frozen plasma? So I'd either give fresh frozen plasma, clotting factors, or I would give the patient platelets, because that's what the aspirin is, a platelet problem. Okay, good. Do we know any other bleeding medications? What's the other one? TPA, yeah, that's a bad one. No antidote for that. And what's the other one? Enoxaparin? Yeah. Let's see. I'm gonna see. Okay. So these are kind of interesting questions. Again, I'm looking for central line questions. I'm looking for CPR, which they do ask. But this one here, I'll do this one with us. During a routine assessment, an obese 50-year-old female expressed concerns about a sexual relationship with her husband. Which is the best response by the nurse? Would I do number 1? Would I do number 2? Number 3? Or does my patient have a problem? And is my patient complaining to me about a problem? And I, the nurse, would like to assess and gather data. So what's the only answer I can pick is number 4, right? ask the person to discuss the specific complications. Here's a nice question for us. Oh, did I get rid of that? Can't see. So what's the safest thing to do in the ideal perfect world where I have all the time in the world, all the supplies, and I never have to worry about where things are coming from? If I want something, I ask for it, and there it is. So what do we know about that saline? It's only good for 24 hours. So you said, I'm definitely not gonna use this. So the only answer you can pick is number 4. Get a new bottle, unopened, etc. Okay? Let's see if we'll do one more question. These, let's see. Here's one last, this will be a sort of a psychic question for us. Where did you, oh, I lost it. 1 second. This one here about the 20-year-old. Lovely psych question. So the person has refused to shower. They have this body odor. The person has this, so what is this patient complaining about though? So the question is really to identify the topic. What is the patient complaining about? She has this thought process that if you bathe, it's not good, right? I mean, for whatever reason, she thinks that. So if that's the case, what's the only answer you can pick here? Is number 4, because what's the issue? She didn't bathe on purpose because she thought it was harmful. So what you're gonna do is number 4. I mean, C's not a bad answer, but we want that interaction, the talking, teaching, blah, blah, blah. You can't do A because it's a kind of an issue, all right? So these, we'll be doing topics and then we'll be doing questions, okay? And so, and then every Wednesday and Saturdays. Wednesday, all right? And if you want Nursing 411, email me. I think that's another, all the stuff in this packet is very important. It's got the key meds, the key labs, the key antidotes, yeah.
Are we gonna finish this next?
Yes, yeah, we'll finish it, yeah.
Okay.
Yeah, we'll be doing it again. We'll work on it every week until we finish it.